Well, good evening, healthcare justice warriors. My name is Rose Roach, and I'm the Executive Director of the Minnesota Nurses Association, and I'm also a board member with Healthcare for All Minnesota and a steering committee member with the Labor Campaign for Single Payer. Welcome to HCAM's fundraiser tonight in Waban Park. Hope everybody is enjoying the food and the weather and all the fun that we have planned for you tonight. I'm really excited about the conversation that I am honored to be moderating for this fundraiser this evening. We are going to be talking with a Canadian doctor and a Canadian nurse. You know, we hear so much about the Canadian healthcare system that we thought it is about time that we get it straight from the people who are both working in that system and also who receive their healthcare through that system. So with that, I am going to do a little bio and introduce each of our panelists tonight, and then we will pose some questions and have a discussion about the Canadian healthcare system. So I want to welcome Tracy, is it Zambori? Am I saying your name right, Tracy? I should have asked that earlier.
You are.
Okay, we've known each other for a while now, and I was like, oh no, is it Zambori or Zambori? So Tracy Zambori is a registered nurse, and she is also president of the Saskatchewan Union of Nurses, lovingly known as SUN. The union represents Saskatchewan's more than 11,000 registered nurses, registered psychiatric nurses, and nurse practitioners. Tracy's journey to become president of SUN was born out of her passion for the nursing profession, commitment to improving patient safety, and belief in social justice, values that flourished within her over the course of her 27-year career as a long-term care nurse. Today, Tracy is one of Saskatchewan's foremost health activists, tirelessly advocating for expanded and strengthened universal health care, improved registered nurse staffing, we can relate here in America, and better access to health care for all. As a nursing leader, Tracy strives to use her voice and influence to advance the principles of truth and reconciliation in healthcare while facilitating crucial conversations around race and gender within the nursing profession. Under Tracy's stewardship, SUN has instigated and led critical dialogue on numerous health and social issues, from Saskatchewan's HIV, youth mental health, and overdose crisis to the future of seniors care and access to rural health in the province. Tracy's leadership throughout the COVID-19 pandemic has been a source of strength for nurses and frontline workers facing extreme system demands, a touchstone for patients and families seeking advice in the face of the unknown, and a driver of government and health decision maker accountability. Tracy represents her members as the current vice president of the Saskatchewan Federation of Labor and as an officer on the National Executive Board of the Canadian Federation of Nurses Union. Tracy lives in her hometown of Stoughton, Saskatchewan, with her husband Sam and their dog Danga. She's known in town for her community service and her love of gardening and baking. We are also really honored to have with us Dr. Ryan Melly, who is a family physician and a public health advocate. He currently serves in the Saskatchewan legislature as the MLA for Saskatoon, Meewasin, have I said that correctly? And as a leader of the New Democratic Party of Saskatchewan. During the COVID-19 pandemic, he returned to medical practice and offers regular clinics at the Lighthouse Shelter in Saskatoon. Ryan is the author of A Healthy Society: How a Focus on Health Can Revitalize Democracy, a book that explores how our understanding of the social determinants of health can and should influence public policy. And it just arrived at my house, I want you to know, Ryan, just a couple weeks ago. So let me start with a question for you, Dr. Melly. Provide us with a little bit of a brief history of the Canadian Medicare system, including its impact on social determinants of health and the political realities of keeping a system that recognizes healthcare as a human right. But as I believe you have said to us once before, once you get it, you gotta fight to keep it.
Absolutely. Well, thank you, Rose. Thanks very much for the invitation. Great to see you. Great to see Tracy. I'm Ryan Miley. You checked Tracy's last name, but mine's a little off as well. Always hard to figure out when we're just seeing things written down. I'm a family doctor in Saskatoon and leader of the NDP. And the NDP used to be called the CCF, the Canadian Commonwealth Federation and later, Cooperative Commonwealth Federation, I should say, and later, and now the New Democratic Party of Saskatchewan and of Canada. So we have our local chapters, just like the Democrats, Republicans have the state level and the national level. It's a little more complicated than that here with more parties at play. But here in Saskatchewan, there are two parties with seats in the legislature, the New Democratic Party and the Saskatchewan Party, which would be, well, our Republicans, seemingly more Republican all the time. I just want to say first, before I dive into the little bit of history, good evening to everyone in Waban Park. Thank you very much for coming out this evening. Thank you for your generosity in supporting the fight for Medicare for all. It matters to patients across the United States, but also to patients here in Canada and across the world. People look to you and the fight that you're in right now as a source of hope, that if we can get Medicare for all in the United States of America, then we can keep it and expand it and improve it in Canada and in places around the world. Now, the history of Medicare in Saskatchewan, books have been written on it, but I will give a real brief overview. I have one of the things that I like to say about my job is I have Tommy Douglas's job. And Tommy Douglas was the premier of our province, which is like the governor in a state, who brought in Medicare for all in 1962. That was after years of effort. The CCF, his party, had been elected 18 years prior, and it took that long to get the finances in order, to have the political fights and be ready to get Medicare for all, which is a good reminder. We elected the people we want to elect, but it also took time to get through the fights and make Medicare a reality. And even once it was introduced as legislation, it wasn't easy. The doctors in Saskatchewan, with help from the American Medical Association, who was against Medicare in Canada at that time, and alongside largely US insurance companies, fought hard, and the doctors even went on strike, stopped providing care. But the public didn't go for it. The public knew that what they wanted was universal access to medical care, and the doctors eventually stepped back from that fight. And within 5 years, the physicians in the province, including the ones who had taken to the picket lines, realized that they had been mistaken and that it was actually a better system to work in after universal medical care was brought in than it was prior. So leaping ahead to the present day, it was a couple of years later, not even very long after, that spread from Saskatchewan to across the country. And now we are looking at 60 years anniversary of that being brought in Saskatchewan and later spreading across Canada. And one of the things that I love about being a family doctor in Canada is that when my patients come to see me, the first question I ask them is how they're feeling, not how they're paying. That just doesn't enter into it at all. So there is something just so beautiful about people who are sick, in need of care, injured, and when we see them for the illness that they have. That's what's most on our mind. And not having that barrier of whether there's insurance, whether there's payment, really allows, one, those patients to get the care they need, but two, us as healthcare providers to not have that as a barrier. But you mentioned that once you've got it, you've got to fight for it. And that is absolutely true. There are always and will always be forces within the conservative parties and the think tanks around them that will try to argue that this isn't the right way to do things, that we need more private care. They chip away at the edges. Here we now have a system where patients can pay for MRIs. So they still wait in the same lineup for the surgeries, but they can jump ahead for the imaging if they've got more money. So they get a publicly funded surgery faster than somewhere else. So little bits of erosion of that universal system are things we're constantly having to fight against. And right now, I see a real challenge for us going forward. Coming through COVID-19, we had lots of services, especially because we had very poor management from our political leaders, chose not to take the pandemic seriously, not to introduce public health measures. And as a result, we had the worst here in Saskatchewan, the worst COVID outcomes in the country, especially in the fourth wave. That resulted in lots of shutdown of different health services, in particular surgeries. And so waiting lists have grown. And waiting lists are always something that are challenging to manage, but especially now. And I worry that they will say, in order to deal with these waiting lists, we need to bring in a whole bunch more private care. So I think that's going to be a big fight over the next few years, fighting to make sure that instead of introducing things that undermine public care, we invest right now in a generational way, learn the lessons of COVID-19 about what's working and what isn't, and really address waiting lists and access to primary care, access to rural health. And I know Tracy understands that world even better than I do, and I look forward to her thoughts on how do we learn these lessons of the current moment and make sure we keep up that fight for public care.
Thank you so much, Dr. Is it Miley? Did I say it right this time? I'm so sorry about that. Forgive me. Great segue to having Tracy speak to just that, addressing some of the lessons learned as our Canadian neighbors from the COVID-19 pandemic, which is still here, as we all know, including how to run a system, provide care during a global pandemic, treatment of healthcare workers, which we know is a bit of a struggle across the world as well. So how did things look up there? Tracy, pros, cons, things you learned from this pandemic?
Oh my gosh. I could go on about this forever. The biggest lesson I think we're learning right now is that we have to force our way to the table. We have to be part of the conversation moving forward, because what's happened in this pandemic is that healthcare professionals, particularly registered nurses and physicians, have been ignored. We have been completely unheard and really left to hang out to dry. So I think the lesson moving forward is that we have to become far more aggressive and assertive in getting ourselves to the table and to be heard, and really have a strong voice and relationship with the public, so that they understand that if they're not hearing from the healthcare professionals, then nothing should be happening. We should not be allowing fringe voices to actually drive healthcare. And that's really what's been happening in Saskatchewan. I mean, what COVID did for us was really tear the curtain off of a very poorly run Saskatchewan Health Authority that's really politically driven. And, you know, healthcare has always been political to a point. It always has been. It's always going to be. It has to be. But what we found this time is those politics made it all the way to the bedside and actually created a divide between patient and nurse. That's never happened before. And it has been probably one of the most devastating things I've ever seen happen in my 30 plus years as a registered nurse. How healthcare professionals have been treated by the leadership of this province and by you know, while it is a small segment of the public, they had a lot of impact and made a lot of noise and were really listened to by the leadership. And that was unfortunate. So that, you know, we will have to make sure that we are really making clear what's going on in healthcare to the public, so they understand how things need to be approached, because it really has been one of the most devastating times for registered nurses ever in the history of our organization. And I mean, we'll be here for 50 years in a couple of years. That I've never seen anything like it, Rose, how it's happened and how our registered nurses have been treated, and how they've shown up every day for the last, you know, 2.5 years, and yet they feel unsupported, unheard. We just did our membership survey that we do every year, and we had a really great turnout. We had, you know, almost 15% of our membership came out to answer, and 70% of them told us that they have anxiety, they feel hopeless, they feel helpless, they are full of anger, they are frightened for patient safety. But the biggest one of all was how they have lost absolute trust in any level of governance, from the health authority, the premier, the minister of health. And when we talk to them about what we need to do moving forward, it is those crucial conversations around retention and recruitment, speaking with educational facilities, being the conduit between bringing unions, educators, and regulatory bodies to the table, to have those conversations so that registered nursing is respected and our voices are heard, because we are the largest group of care providers in the province. We touch every single patient from every corner of this province. And we know that when we wind our way through this and we start picking up the pieces of the healthcare system, because that's what registered nurses do, we know that we are going to have to be treated a certain way to move ourselves forward.
That certainly is similar to what we experienced here as well. The fact that we did not have those who are at the bedside involved in having a conversation about what does it look like to have a pandemic upon us and how do we deal with it and what are the best ways to do this was really difficult and devastating. And it certainly exposed all of the flaws of the system. There's no question about that. If I can go back to you, doctor, for a second, one of the things we hear as a physician, I want to ask is, there's just physicians from Canada just flocking to get over the border and come here in America and leave Canada because it's so much better and so much more lucrative, I suppose, to practice medicine down here. How real is that? You guys do any tracking of how many and I'm sure there are some, I have no doubt, but whether or not there is a mass exodus of providers that are coming to the States instead?
No, there isn't. And I mean, I would have to look at the exact numbers, but it's not something that we hear of at all. I don't have a single colleague that I went to medical school with that chose to go to the United States. And there's reasons for that. I mean, there's always challenges moving countries, but I think there's a real value, and that value has grown over the years among the medical profession of that principle of being able to care for patients based on their need, not their ability to pay. And I've certainly seen it, and Tracy, I'm sure you've witnessed this as well, a growth in our profession of people who advocate for that. We've got a great group called Canadian Doctors for Medicare that really does the work to crunch the numbers on what does make a difference in terms of what we're paying for healthcare. Healthcare in Canada is actually far less expensive per patient than it is in the United States, largely due to administrative costs and profit that is taken by the large insurance companies, so that we're getting better quality care and better outcomes at the same time as spending less money. So people want to work in that kind of system, and those groups like Canadian Doctors for Medicare have raised the knowledge of that among the general public as well as among folks in the profession. The other shift that I've seen, and this to me is really interesting, is for most doctors, Medicare isn't the fight. The fight is no longer should we or shouldn't we have private care. People have moved on. They've made the decision. Public health care, universal, publicly funded healthcare is the answer. Nobody wants to change that. Now they're wanting to move upstream and talk about how do we keep people out of our healthcare system. And this is where I think the real next step is how do we have that understanding of the social determinants of health, that what has the biggest impact on whether you'll be sick or well, whether your life will be long or short, isn't whether or not you can walk into a clinic or an emergency room. It's whether you can walk into a decent house and a decent job and a decent school. And those factors that are upstream from healthcare are what is motivating a lot of physicians now to really focus on prevention. And that is true at any time. But often when we're talking about this, we're thinking of, hey, if you invest in early childhood development, you'll have healthier adults 20, 25 years down the road. Well, in these last few months, we've seen how public health decisions made today can save a life 10 days, 14 days down the road. So that concept of prevention and upstream action has really become so much more front and center. And I think you're going to see folks in the health professions coming out of this COVID experience with an even greater focus on, yes, preserving universal, publicly funded, accessible healthcare, but also fighting for investments in addressing inequality, in education, in food security, and safe housing, and using those investments and wise decisions upstream to keep people healthy and save money, take pressure off of those wait lists and those access issues within the healthcare system. The best way to relieve pressure on our healthcare system is to keep people healthy in the first place.
Very well said. Makes me think about, we talk so much about how health is the issue of intersectionality amongst the justice movement in general, right? Because as you said, poverty, you know, not having access to housing, public transportation, racism, immigration, all status, all of those drive health outcomes. And so if we really want to concentrate on health, it's more than just that doctor visit, as you said, or that you know, being at the bedside. It's so much broader than that. Tracy, now we heard sort of a physician, you know, perspective on whether or not to practice there or to come down here. Talk a little bit, and you and I have done this before, but about Canadians, how they feel about their healthcare system. There's no perfect healthcare system, doesn't exist, right? But generally speaking, how do the Canadians feel about their healthcare system? Because we sure hear that they just hate it up there.
Well, it's unfortunate that there seems to be a core group of people that want to spread malicious lies, because I got to put it out there plainly. The Canadians absolutely cherish their publicly funded, publicly administered healthcare. Do they sometimes want to jump the queue or get ahead of or want something? Yes, they do. And with a little bit of guidance and a little bit of conversation, most people understand. But the publicly funded, publicly administered healthcare, anytime there's a survey on some of the most important things, it's always number one. Nobody wants to lose that. We still have enough seniors around that well, my parents' age, Ryan's parents' age, that knew what it was like to actually have to pay for healthcare. My grandparents worked very closely with Tommy Douglas. You don't say his name without your hand over your heart in my family. Yeah, he was, you know, sitteth on the right hand of you know who. Anyway, I digress. But anyhow, no, our Canadians, my people, our people north of the border, absolutely cherish their publicly funded, publicly administered. Any type of survey always brings it to number one. And any type of survey always puts healthcare providers as the most trusted and most respected when it comes to any sort of conversation. And Ryan's in a funny spot. As a physician, he's close to the top of everybody he likes. But as a politician, unfortunately, that goes down dramatically. But you know, really, what publicly funded, publicly administered healthcare is an investment in people. And if we're not going to invest in people, we're never going to get there. And I know that you folks, if I may get political for a second, are coming into some pretty important elections, I believe, later this year, right? And if you want publicly funded, publicly administered, single payer healthcare, you have to vote for a Democrat. If you vote for a Republican, you're not going to get it. It's not going to happen, because we have to have a party that talks about community. The party that Ryan leads, New Democrats here in Saskatchewan. We're a small bunch, but we're strong. And the fact of the matter is that it's all about community. We have to think about one another. It isn't, give me this day my daily bread. It's give us this day our daily bread. It's about community. It's about looking after each other, friends and family. And that's really the premise of Medicare. Tommy Douglas said that he was never going to again see people lose their entire farms because their child was ill. And this is what was happening. And the CCF, the New Democratic Party of Saskatchewan, knew that that couldn't go on anymore. And the people that were surrounding Tommy Douglas were the people who were grassroots people. This was brought together by community. And you know, in Saskatchewan, it's a bit of a struggle right now, because we do have a very loud, albeit maybe not that big group of people who are all about themselves. It's all about what they can get, how it affects them, and they don't care about who else is around them. And that's the force that we're up against. And we're up against it all the time, like with this shortage of healthcare professionals, plus a waiting list, a surgical wait list, because of COVID. There is conversation about bringing in, some private surgical outfits to try to catch ourselves up. Well, we've walked down that path before here in Saskatchewan, and it did nothing. It did nothing except cost the public system money. or yeah, the public system money. And, you know, the public system is still going to be in charge of all the complicated surgeries, and they're thinking about shuttling the less complicated ones over to the private. But if we haven't got enough people to actually do the job in the public system, there's no possible way that a private one is going to manage itself either. So, you know, the more that we can talk to people about how important it is. You know, my husband is from Minnesota, and so all of his family is there. And when Obamacare was starting to pick up steam, another great myth that I was approached at by my in-laws was that they heard about death panels. And I said, what is it? What are you talking about? I don't even know what that is. And apparently there also is the rumor that people like Ryan and myself can sit on a panel and decide who lives and who dies. Well, that absolutely is not the case. Never has been the case, never would be the case. It's actually quite distressing how people will go to such great lengths to try to take something so fundamental and so correct away from people just to make profit. It actually really is quite disturbing.
It is indeed. And, you know, when you touched on people losing their farms, you know, the whole issue of becoming bankrupt because you had the audacity to become ill with cancer or something like that. As you know, that's highly prevalent here in the United States. And, you know, we have many allies here in the movement who are farmers and who actually, you know, run their own business. We have lots of small business owners, the backbone of our economy here in the United States. So I wanted to shift over for a second and maybe ask you, Doctor, if you could just have any thoughts about, you know, is it true that the Canadian businesses are able to be more competitive because their cost for employees' healthcare is done via a tax on all businesses, so making it much more cost effective and easier to predict than it is here in the American system, where every year they have to renegotiate, and usually both employers and employees, you know, don't get the right end of that stick.
That's right. So it's better for the business owners. They don't have to be negotiating health coverage. It's also better for the workers. They don't have to, when they're negotiating their wage and their benefits, they don't have to be thinking about whether or not they can have access to basic care, and they can focus on other things, wages and sick days and other benefits that are not core what's covered right now. So it's absolutely a competitive advantage for businesses here, and it's a great advantage for workers. And in fact, that leads us to one of the other pieces that we're fighting on as the next stage. Because right now, many people with their job, they'll negotiate drug coverage. They'll negotiate, say, coverage for physiotherapy or some counseling, other things, adjunct healthcare, we'd call it. Drug coverage is one in particular where we spend far more on medications than other countries that have medications, pharmacare, we call it, medications as part of their Medicare system. And most of Europe does, most of the world that has universal healthcare. I think Canada is the only country that doesn't include drugs in some way. So that's the next step for us, and it's such an interesting comparison where you look at how we spend and our outcomes on healthcare, we're competitive with the rest of the world. When we look at how we spend on drugs, we're spending way, way more. So that's a good example of how to take the fight to the next step and include medications, but it also is a really good contrast of the things that are within the public system we are able to do in a much more effective and affordable way than those things that have remained outside.
Pharmacare. Tracy, do you want to say a few words about that as well? Because I know the nurses are certainly helping in that fight for that next step. Do you want to talk a little bit about your activism on that?
Absolutely. We, you know, as the Canadian Federation of Nurses Unions that I'm so proud to be a part of, and all of our 11,000 members, we've been fighting for pharmacare for quite some time, for about 25 years now. And it is one of the most important things that we could score right now, because we are hearing more and more of seniors who are dividing their pills up to try to, because they have to decide between rent and medications. There is a formulary, there is some ability to get special drug status, but if you're on really expensive medications, it's a whole different thing. And we know that, it always was the vision of Medicare to expand itself, to push itself to the next level. And we're actually feeling a little bit more heartened because there has been a really good political move out of our federal government where there is a partnership between the New Democratic Party and the Liberal Party of Canada, where they're going to be working on some things that they've made bipartisan, where they can actually work together. And that's working towards, a pharmacare for all and dental care for all, and the kinds of things that if we go all the way back to TC Douglas, this was the ideology that really bloomed the New Democratic Party, and how we can move together. Because I think it's important as part of a robust healthcare system, robust primary healthcare, is we cannot have people worrying about whether they can afford their medications or not. Because the minute someone with a chronic illness can't afford their medications, then we know their illness becomes acute, and we know they end up in the healthcare system. And the money is not being spent in the best way that it could, because every time someone comes into the emergency room, it's at minimum about $25,000. So the more we can keep people out of the emergency room, have that primary health care done in the community where it should be, and they have the stability of those medications, then we know that it's just a win-win for everybody. So we're feeling quite hopeful. It's taken 25 years, but we're willing to keep fighting the fight. And that's really what it's all about, is that we don't give up, because we know it'll work.
Absolutely. Well, before we end our discussion here tonight, I wanted to see if either of you wanted to, you've got an opportunity to talk to Americans, to inspire us, to provide some final remarks or comments about tonight's discussion between the Canadian and American healthcare system. So Doctor, I will let you go first, and Tracy, I'll give you the final word.
Great. Well, thank you so much, Rose, and thanks, folks, for joining us tonight. I hope you're having great weather and a great evening. As a doctor, as a dad, as a political leader, I just have to say, keep up the fight for Medicare for all. It's worth it. It's the right thing to do for the patients you care for your families, and for the United States. It would be a huge step forward for your country and for the world if we saw Medicare for all brought in. And for that, I thank you for fighting for it. Keep it up.
Thank you. Tracy?
Well, and I just echo what Ryan said. Just keep up the good fight. Medicare for all, single payer is really the only way to have a sustainable community. It is, you hear all sorts of rumors, and I hope we've been able to dispel a lot of them. And you will hear that people say that we have waiting lists, and yes, we do. But we also have all sorts of strategies on how to work our way through that. So please don't let anybody try to sell you a false bill of goods. Medicare for all, publicly funded, publicly administered healthcare really is a crown jewel. It keeps people healthy and alive. Nobody loses anything when they come into the healthcare system. They know that they're going to be able to enter, get the care that they need, and exit and go home, and still have a home to go home to, because they won't have lost it to the debt of the debt collectors who are going to come after you if you've had any sort of procedure. So thank you for coming tonight. Looking forward to maybe getting down to Minnesota for a vacation. It's been a while. Maybe Rose, we can have a visit. But please, everyone, take care and stay safe. And thanks for your activism, and just keep going. Just keep going. Don't stop.
Thank you both so much, and you can be guaranteed it's a date. Tracy, you come into town, you let me know, and we're going to go have some fun together. But thank you so much for doing this tonight, helping us dispel those myths, educate people on what it's really like to be both a patient and a practitioner in the Canadian healthcare system, and keep up your fight as well, because we stand with you in solidarity as you do with us, because healthcare justice is the right thing for all of us. So thank you again both so much, and have a great evening, everyone. Bye.